Welcome back to Mountain Connection. Summit County has a new mental health network. It's called Healthy You Behavioral. And here to tell us more about it is Newman from the Summit County Health Department and Tracy Altman from the University of Utah. Thanks for being here, both of you.
Thank you.
So this just rolled out very beginning of September, and there's already more resources and things happening.
Absolutely. This has been a tremendous win for our community. Over the past several years, we've not necessarily struggled, but it's been hard to get people the services they need due to wait times. By partnering with you, we've now pretty much reduced all of those wait times. Just from day one with the signing of the contract, we had access to 6 psychiatrists off the bat and about 30 providers. And now I just learned it's way above that and continues to grow and grow. So it's been just amazing to see this transformation in our community.
We've gone from having 8 providers to having over 300 that we have access to in our community, and it's just growing. So.
From 8 to 300.
Yes.
So did it just take this organizational network to get people on board and to find those mental health professionals that are here wanting to help?
We have over 70 that are here in Summit County alone that have wanted to help. And that number keeps growing. Plus we have all of the University of Utah Neuropsychiatric Institute providers that are on board and that are coming up to help as well. And we have our new Uni Clinic in Park City that is available now.
And what's been amazing is the status that U has as an accountable care organization really gives us access not only to all the different clinicians that we have pre-existing here in Summit County, but for the first time we can access resources in Wasatch County and Salt Lake County as well to be part of our network. Beforehand, we were limited because of our district boundaries due to state legislation, but with their role as the state's accountable care organization, those boundaries no longer apply to us and the residents of Summit County.
And not only that, there's more options for people who have Medicaid or no insurance.
Right,
Correct.
right.
We continue to see, unfortunately, the unfunded population, it's always a battle at the state legislature on how much funding you can get for that, but we've remained pretty constant. Also with this expansion of network and so many more providers, we're able to bring people back into Medicaid that may have left the Medicaid system because they couldn't handle the wait times or just wanted to see someone else. Now, because of this network model, we can bring those people into the system, or if they have a clinician that they're seeing that isn't part of it, the U will work with them to get them in our system so they can maintain that continuity of care for the client, but then still have the Medicaid accessible.
Yeah, that's just such an exciting time, I think, because it can be such a problem no matter where you live in any state. I think it's a nationwide problem. When you know you need that care and you find out 6 weeks, my child can get help in 6 weeks, that's too long. When you're
Right.
dealing with mental
Right.
health issues, that is too long. So it's very refreshing to see this model and excited to see going forward how it comes together, because I think it will definitely be copied in other communities.
One of the other things that we've started is a school-based program where we have providers in each of the schools in the county. So each public school and charter school in each school district has at least 4 hours of a counselor in the school each week. And that is so that non-funded or uninsured, Medicaid, individuals who may have high deductibles, any student can see these counselors. And we wanted to ensure that those therapists were there not just for appointments, but were able to be utilized with the teachers and with the administrators, and could help with resolving issues in the classrooms. We wanted a resource for our schools. And so we put together this program. It's a very robust program, and it's unique to Summit County. There isn't another program like that in this state.
It just makes so much sense to have those resources in the schools. There's also been some crisis lines
Yes.
coming out as well just this past week. Tell me about those.
So just in the past 2 weeks, the down over, was it the Federal, not Trade Commission, I keep wanting to say, Communications Commission, thank you,
FCC.
FCC, just released approval for a 3-digit crisis line number. We're still waiting to hear exactly what those 3 digits will be, but here for Summit County, we're expanding our crisis services. So the University of Utah will be, during business hours, handling crisis calls and crisis walk-ins at their new Uni location at 1820 Prospector.
Sidewinder,
Thank
yes.
you, Sidewinder. And beyond that, we're working with Wasatch County to develop what we're calling a regional stabilization team, which will be comprised of local clinicians that can go outside of those hours and respond to calls. And the reason why that's important, a lot of times 911 is the first call people make in our community. And so we have a law enforcement respond to those situations. While we have 100% of our sheriff's department trained in crisis intervention training, or CIT, which is a behavioral health training, it's nice to have those professionals there as well to help them make determinations. Should this person go straight to the jail? Is this something we can talk with them? Is this an individual that we can take to a receiving center at the University of Utah? So it really expands the options we have out in the field for people dealing with a mental health crisis.
So we're going to put up those numbers. The crisis line is manned 24/7 by both English and Spanish speaking mental health professionals. That number is right below me on the screen. And then there's also another number if you're not in crisis, but you know you need help, that you can call and kind of talk through those resources. Is that correct?
Right.
More of a clinic number?
This is our clinic, our walk-in number. We have a Uni Park City clinic up here on 1820 Sidewinder. We have walk-ins available during the day, and if you have a crisis, you can come in there. If you need an appointment, you can talk to them. They're willing to help out. You can also contact Healthy U Behavioral either through our website at healthyubehavioral.com, and you can, there's a way to contact us there, or you can reach out to us. Our phone numbers are on there as well. The Uni Crisis Clinic or the Uni Clinic is probably the easiest and most convenient way to reach out to us, but you can reach out to us via the website as well.
Perfect. And Erin, to add some context to this, there's a report that just came out today about
Correct.
worldwide suicide rates.
Yeah, the World Health Organization just released their annual study on suicidality. And while I haven't had a chance to read the report yet, one of the takeaways I saw just from the summary is every 45 seconds, someone loses their life to suicide worldwide. And that's an increase and continues to grow. Based on the data right now, individuals 45 and younger make up 68% of all deaths by suicides worldwide and continues to grow. This is a concern. One of the areas too I'd recommend, in addition to these phone numbers, that your listeners be aware of is the Safe UT app.
Right.
You can go online, you can download it from both the Android and the iPhone store, and it's an incredible app. It's great if you're having anxiety. It's not just for if you're having suicidal thoughts. If you're having some sort of mental health issue and you're in the middle of a large room, last thing you want to do is pick up your phone and talk. The app allows you to have a one-on-one text conversation. And I've seen for a lot of individuals just having access to that right there and to have that conversation when they're in a room really helps address those concerns at that point. So I really encourage everyone to go online, download that on your phone. Now, it may say you need to register for a school. It is designed for a school, but it's a wonderful tool for everyone to have. Just pick one of the schools. Unless you're going to be giving reports to the school, don't worry about which one you choose.
Definitely very excited, very lucky in our community to have this Healthy U Behavioral Mental Health Network. I'm sure we'll be talking even more on the show as things develop and more resources come available. So thanks so much, Erin and Tracy, for being here today.
Thank you so much.
Thank you.
All right, lots of information. Head to summitcountyhealth.org if you want more information. Also, University of Utah Healthy U. Lots of things coming to help you with your mental health struggles in this community. We have more coming up right after this on Mountain Connections.